When was the last time you woke up with a morning erection? Last week? Last month? Honestly, can you even remember? If you're over 60 and morning erections have become increasingly rare or have completely disappeared, your body is trying to communicate something important to you. And it's not just, well, you're getting old. Morning erections are actually one of the most reliable indicators of your cardiovascular health, hormone balance, and overall vitality. And when they disappear, there's usually a specific, identifiable, and most importantly, fixable reason behind it. Today, I'm explaining exactly why this happens to so many men after 60, and more importantly, what you can actually do about it. Before we go any further, hit that like button right now and drop a comment telling me where you're watching from, because what I'm about to share could fundamentally change how you understand your body's signals and warning signs. Here's what most men don't fully understand. Morning erections aren't random occurrences, and they're definitely not just about sexual arousal or desire. They're actually a direct measurement of whether your blood vessels, hormones, and nervous system are all functioning properly together. My name is Dr. Jocelyn, and I've spent 5 years as a urologist, helping men understand what their bodies are trying to tell them through various physical signs. And one of the most consistently misunderstood signals is the gradual or sudden disappearance of morning erections. The biggest myth I hear repeatedly in my practice is this: I'm just getting older, doc. It's completely normal for them to stop. And while it's absolutely true that the frequency can decrease somewhat with age, complete disappearance is not normal. It's actually a warning sign that something needs attention. Here's what's actually happening biologically. Every single night during REM sleep cycles, healthy men experience 3 to 5 erections that last approximately 25 to 35 minutes each. This isn't about arousal or dreams, it's your body's way of maintaining tissue health, testing your cardiovascular system's responsiveness, and ensuring everything continues working properly. When morning erections disappear entirely, it typically indicates one of 3 things is going wrong in your body. Number 1, your cardiovascular system is struggling, blood vessels have become stiff, circulation is impaired, or you may have early vascular disease developing. Number 2, your hormones are significantly out of balance. Typically, this means low testosterone, but sometimes it involves thyroid issues or other hormonal problems. Number 3, your sleep quality is seriously compromised. You're not reaching the deep REM sleep stages where these nocturnal erections naturally occur, often due to sleep apnea or other sleep disorders. Here's the genuinely good news. All 3 of these underlying causes are medically addressable. And when you identify and fix the root cause, morning erections very often return naturally. In my 5 years of practice, I've diagnosed serious health conditions: heart disease, diabetes, sleep apnea, significant hormonal imbalances simply by asking men detailed questions about their morning erections. It's honestly one of the most valuable early warning systems we have available in medicine. So here's what we're doing today. I'm walking you through the 5 most common reasons morning erections disappear after 60, and I'm giving you specific, actionable solutions for each underlying cause. And if you stay with me until the very end, I'm revealing a simple morning routine that several of my patients specifically credit with restoring their morning erections within just a few weeks of consistent implementation. Now, let me walk you through the 5 main reasons morning erections disappear after 60 and what you can actually do about each one. And if you're serious about understanding what your body is trying to communicate, hit that subscribe button right now, because this information could literally save your life by catching problems early. Number 5, poor cardiovascular health, the blood flow problem. This is by far the most common underlying reason, especially in men over 60. Your blood vessels have gradually become stiff, chronically inflamed, or partially blocked by plaque buildup, which reduces blood flow throughout your entire body, including to the areas necessary for morning erections. Here's the biology, and this is absolutely crucial to understand. Morning erections require healthy, flexible blood vessels that can dilate quickly and deliver adequate blood flow on demand. When your vascular system is compromised, whether from high blood pressure, elevated cholesterol, diabetes, smoking history, or chronic systemic inflammation, blood vessels simply can't respond properly to the signals your body sends during REM sleep. And here's the critical medical connection that every man needs to understand. The blood vessels involved in erections are actually smaller and more sensitive than the coronary arteries feeding your heart. So cardiovascular problems show up there first, often several years before you experience a heart attack or stroke. Clinical research consistently shows that men who lose morning erections have significantly higher risk of cardiovascular disease developing within 3 to 5 years. It functions as an early warning system that you should absolutely pay attention to. Emotionally, this information can initially be alarming, but it's also genuinely empowering because you can take meaningful action before something far more serious happens to your health. Practically speaking, addressing this means getting your cardiovascular health thoroughly checked: blood pressure, cholesterol panel, fasting blood sugar, inflammatory markers like C-reactive protein. Optimizing these numbers through intentional lifestyle changes and medication if medically necessary. Exercising daily, even just 30 minutes of brisk walking, consistently improves vascular function. Eating a heart-healthy diet rich in vegetables, fruits, fatty fish, nuts, and olive oil. Quitting smoking completely if you currently smoke. Limiting alcohol consumption to moderate levels or less. I had a 64-year-old patient last year who hadn't experienced a morning erection in over a year. We did comprehensive cardiovascular testing. His LDL cholesterol was dangerously elevated and his blood pressure was poorly controlled despite medication. We optimized both conditions through adjusted medications and significant lifestyle changes. 6 months later, morning erections had returned consistently, and we caught his cardiovascular disease early enough to prevent potentially serious complications. The simple fix for this one: prioritize your cardiovascular health above almost everything else. It's the absolute foundation. Number 4, low testosterone, the hormone problem. Testosterone levels naturally peak in the early morning hours, and adequate testosterone is essential for triggering those nocturnal erections during REM sleep. When testosterone drops too low, morning erections decrease in frequency or disappear entirely. Here's the biology. Testosterone doesn't only affect libido and sexual desire, it directly affects the nerve signaling and vascular response that are necessary for achieving erections. When testosterone is clinically low, your body simply doesn't initiate the erectile process effectively during REM sleep cycles. Clinical studies consistently show that men with low testosterone levels have significantly fewer nocturnal and morning erections compared to men with testosterone in the normal range. Emotionally, low testosterone affects so much more than just morning erections. It impacts your energy levels, mood stability, motivation, muscle mass, bone density, and cognitive function. The disappearance of morning erections is often just one visible symptom among many that men experience. Practically speaking, addressing this means getting comprehensive hormone testing done: total testosterone, free testosterone, sex hormone binding globulin, and estradiol levels. If testosterone is genuinely low, generally below 300 nanograms per deciliter total, or low free testosterone, even with normal total levels, discussing treatment options thoroughly with your doctor. Natural approaches to support healthy testosterone production: regular resistance training, adequate quality sleep, effective stress management, consuming healthy fats in your diet, maintaining a healthy body weight, considering testosterone replacement therapy if medically appropriate for your situation. I had a 67-year-old patient with no morning erections, chronic fatigue, and persistently low mood. His testosterone level was in the bottom 5th percentile for his age group. We started carefully monitored replacement therapy. Within just 3 months, morning erections had returned, his energy improved dramatically, and he told me with emotion, "I genuinely feel like myself again for the first time in years." The simple fix for this one: get your testosterone levels checked properly. If they're clinically low, address it through lifestyle optimization first and medical treatment if appropriate. Number 3, sleep apnea, the oxygen problem. You only experience morning erections during deep REM sleep stages. If you're not consistently reaching REM sleep, or if your sleep is constantly interrupted throughout the night, you simply won't have morning erections. Sleep apnea is one of the most common and chronically underdiagnosed causes of this specific problem in men over 60. Here's the biology. Sleep apnea causes repeated breathing interruptions during the night. Your blood oxygen levels drop repeatedly. Your brain partially wakes you up to restore normal breathing. You never reach the deep, restorative REM sleep stages, where morning erections naturally occur. Without adequate REM sleep, there are no morning erections. And chronic oxygen deprivation during sleep also progressively damages blood vessels throughout your body over time, which compounds the erectile problem even further. Clinical studies demonstrate that men with untreated sleep apnea have dramatically lower rates of morning erections compared to men without sleep apnea, even when testosterone levels and cardiovascular health are comparable between groups. Emotionally, sleep apnea also causes chronic exhaustion, mental fog, irritability, and can contribute to depression. You feel terrible throughout the entire day. Practically speaking, addressing this means if you snore loudly, gasp or choke during sleep, or consistently wake up feeling exhausted despite sleeping 7 to 8 hours, get properly evaluated for sleep apnea. A formal sleep study can definitively diagnose the condition. Treatment with a CPAP machine or other interventions can be genuinely life-changing. I had a 68-year-old patient who was exhausted constantly and hadn't had a morning erection in several years. We ordered a sleep study. He had severe obstructive sleep apnea. He started using a CPAP machine consistently. Within just 6 weeks, his daytime energy had returned dramatically, and so had his morning erections. He said with amazement, "I didn't even realize I hadn't been breathing properly for years." The simple fix for this one: if you suspect sleep apnea based on symptoms, get tested and treated promptly. It changes absolutely everything. Number 2, medications, the side effect problem. Many extremely common medications suppress morning erections as an unfortunate side effect, and most men don't realize there's a direct connection to their medications. The biggest medication culprits include blood pressure medications, especially beta blockers, and certain diuretics, antidepressants, particularly SSRI medications, prostate medications like finasteride or dutasteride, antihistamines for allergies, acid reflux medications, particularly proton pump inhibitors. Here's the biology. These medications work through various different mechanisms in your body, but many of them either reduce overall blood flow, suppress hormone production, or interfere with nerve signaling, all of which can eliminate morning erections as an unintended consequence. Emotionally, it's incredibly frustrating to take medication to treat one legitimate health issue, only to inadvertently create another significant problem that affects your quality of life. Practically speaking, addressing this means reviewing all your current medications thoroughly with your doctor, asking specifically and directly, could any of these medications be affecting my morning erections or sexual function? Discussing alternative medication options, there are very often different medications within the same therapeutic class that don't produce the same side effects. I had a 62-year-old patient who lost morning erections within just weeks of starting a beta blocker medication for blood pressure control. We switched him to an ACE inhibitor instead, which controlled his blood pressure equally well. Morning erections returned within about a month. The simple fix for this one: don't just passively accept medication side effects that significantly impact your quality of life. Work proactively with your doctor to find alternative medications that effectively control your medical condition without eliminating normal function. Number 1, chronic stress and poor sleep quality, the nervous system problem. Chronic, unrelenting stress keeps your body stuck in constant fight or flight mode, which actively suppresses the parasympathetic nervous system response that's absolutely necessary for morning erections to occur. Here's the biology. Morning erections occur specifically during REM sleep, when your body is in a deeply relaxed, parasympathetic dominant state. Chronic stress keeps cortisol levels elevated, disrupts your normal sleep architecture, prevents you from reaching deep REM sleep stages, and keeps your nervous system in a state that's fundamentally incompatible with normal erectile function. Clinical studies show that men experiencing high chronic stress and poor sleep quality have significantly fewer nocturnal erections, even when their cardiovascular health and hormone levels are completely normal. Emotionally, chronic stress negatively affects everything in your life: mood, relationships, physical health, mental clarity, and the loss of morning erections becomes just one more thing, creating anxiety, which creates even more stress, which makes the underlying problem progressively worse in a vicious cycle. Practically speaking, addressing this means making 7 to 8 hours of quality sleep every night an absolute non-negotiable priority, developing and maintaining a consistent sleep routine and schedule, actively practicing stress management techniques, meditation, deep breathing exercises, yoga, daily walking, genuinely addressing the sources of chronic stress in your life rather than just managing symptoms, limiting screen time for at least an hour before bedtime, keeping your bedroom cool, completely dark, and quiet. I had a 71-year-old patient under enormous chronic stress while caring for his wife with advanced dementia. He hadn't slept well or had a morning erection in over a year. We worked together on sleep hygiene strategies, stress management techniques, and connecting him with community support resources for caregiving. 3 months later, his sleep quality improved dramatically, and morning erections returned regularly. He said with relief, "I didn't realize how much the stress was literally destroying my body." The simple fix for this one: make sleep quality and stress management absolute non-negotiable priorities in your life. Now, here's the simple morning routine that helps restore morning erections. Several of my patients specifically credit this morning routine with bringing back morning erections within just a few weeks of consistent practice. Step 1. Morning sunlight exposure for 10 to 15 minutes within 30 minutes of waking. This naturally regulates your circadian rhythm, which directly controls hormone production throughout the entire day. Get outside, no sunglasses, just natural sunlight exposure. Step 2. Contrast shower. End your regular shower with 30 seconds cold water, 60 seconds warm water, repeated twice. This practice improves vascular function throughout your body and trains blood vessels to respond quickly and efficiently to changing demands. Step 3. 20 to 30-minute walk at a comfortable pace. Morning cardiovascular activity improves circulation and supports healthy vascular function consistently throughout the day. Step 4. High-protein breakfast with healthy fats included: eggs, avocado, nuts, fish. These whole foods provide the essential building blocks for optimal hormone production. Step 5. 5 minutes of deep breathing or meditation practice. This consciously activates your parasympathetic nervous system and actively reduces stress hormone levels. This comprehensive routine addresses circulation, hormone production, nervous system regulation, and overall health simultaneously. I've had multiple patients implement this exact routine consistently and report that morning erections returned within 2 to 4 weeks. Your daily practical action plan. Number 1. Get comprehensive health screening done: cardiovascular markers, complete hormone panel, sleep quality evaluation. Number 2. Address the most likely underlying causes based on your specific results: cardiovascular health, testosterone levels, sleep apnea, medication side effects, chronic stress. Number 3. Implement the morning routine I described consistently for at least 30 days. Number 4. Track your progress. Honestly note when morning erections return and how you feel overall. Number 5. If nothing improves after thoroughly addressing these factors, schedule an appointment with a urologist for deeper evaluation. The key is taking proactive action, not just passively accepting decline as inevitable. I need you to truly understand something important. The disappearance of morning erections is not just normal aging that you have to accept. It's your body sending you important, actionable information about your health. But here's the genuinely empowering part. It's information you can actually use. It's a clear signal that something needs attention and that something can almost always be significantly improved with the right approach. You're not broken. You're not past the point of help. Your body is actively communicating with you. Listen carefully to what it's saying. Hit that like button if this video helped you understand something important your body has been trying to tell you. Share this video with another man who needs to hear that disappearing morning erections aren't just normal aging. They're a meaningful signal worth investigating and addressing. Subscribe to this channel if you haven't already. I'm here to help you understand your body's signals and take proactive action before small problems become serious ones. And remember this: morning erections aren't just about one isolated thing. They're a reliable barometer of your overall health status. When they disappear, your body is asking you to pay attention. Listen carefully. Investigate thoroughly. Take meaningful action. You're not too old. You're not finished. Small, consistent changes lead to surprisingly big improvements. I'll see you in the next video. Take care of yourself because you're absolutely worth it.